our distinguished panelists are going to dive into two things: the political imperatives, as well as the impact to date of how we are advancing health equity and sustainable societies through genuine social participation. I have the pleasure to hand the floor back now to President of Slovenia, who actually has a diverse and rich career, both in the public and private sector, devoted to human rights, gender equality, rule of law, data protection, and hate speech, which is a perfect basis for why we're here around the table today. Your Excellency, Slovenia is a driving force in increasing equity in society. It's exemplary in how it's systematically working with civil society and putting laws and mechanisms in place to ensure diverse voices, genuine dialogue that lead to better health services. Please, can you tell us how you're doing this and what success so far?
How we are doing about gender equity and...
No, how you are advancing social participation for equity and sustainable society.
Sure, and this is all strongly connected to health. I mean, the description of myself that you just explained to the public, it sounds that we are talking, that we are going to talk mental health today, because, you know, I was a human rights lawyer dealing with data protection, access to public information, hate speech. This is all about mental health, but we are going to discuss different health topics today. So just to let you know what we are doing in Slovenia. Over the past 5 years, the world has faced unprecedented challenges: the COVID-19 pandemic, climate crisis, economic instability, and widespread misinformation. These crises have tested us as societies rapidly digitalize, age, and become more polarized. Those are all the facts. Armed conflicts, cuts in international aid, and shifting priorities away from social commitments towards defense investments further add to the risk we face in achieving development goals, including those in health. At the same time, the integrity of global architecture and the principles of multilateralism are being questioned. And this is the part that I really do not like. This complex context has increased vulnerabilities and exposed deep inequalities. People rightly expect governments to act and ensure healthy, safe communities where well-being is central to policy making. When adopting the 2030 Agenda for Sustainable Development, governments pledged to leave no one behind, whether due to social or economic insecurity, environmental risks, discrimination, or mistrust in institutions. Yet international reports show that progress is not unfolding as expected. We must act differently and seek resources in places we have traditionally overlooked. In my country, we have invested for decades in institutionalizing social participation in health, harnessing the potential of both civil society at large and non-governmental organizations. Our approach has included establishing a legal basis for citizens' participation in decision-making processes, co-financing civil society and non-profit organizations through public tenders, and creating platforms for the exchange of best practices. We have insisted on close cooperation between civil society organizations and professionals to ensure that their work is evidence-based. To build trust, we established a dedicated department within our Public Health Institute to provide training, facilitate communication, and promote social participation across civil society, professional groups, communities, and the media. Allow me to share 4 successful examples from Slovenia. HIV prevention. In the 1990s, unlike some neighboring countries where infection rates among intravenous drug users reached up to 60%, Slovenia avoided an HIV epidemic, even within these high-risk and hidden populations. This success was largely due to the public investment in NGOs working closely with communities and supported by addiction centers in primary healthcare. They promoted needle exchange, anonymous testing, and methadone maintenance programs, critical measures in preventing transmissions of the virus. And then we have colon cancer screening. This is another very, very important project. Reaching men for colon cancer screening proved to be another challenge. Initially, only about 40% of men participated, compared with around 60% of women. To increase participation, we partnered with trusted NGOs such as volunteer firefighters, and flooded. Well-organized mental health organizations, co-financed from the public budget, provided timely support for the traumatized population. Their intervention helped ease the burden on families and reduced pressure on the health system. Then we have youth participation. Last, though by no means least, is the example of youth participation. Supported by the government and professionals, organized youth groups have for years promoted healthy lifestyles among their peers. They have successfully advocated for stronger tobacco, alcohol, and nutrition policies, and their efforts have been recognized by both the EU and WHO. I am very proud that our youth are not only advocating for a healthier future in Slovenia, but have also launched the Youth Health Organization, which has been welcomed into the Youth Council and the World Health Organization. This shows the commitment of young people when they are given the chance to shape a healthier future. Encouraged by these positive results, we have joined forces with Thailand and other countries to bring social participation to the global stage. Last year, we proposed a resolution at the World Health Assembly, which was adopted and calls for its full implementation. By engaging the WHO, we aim to monitor the impact of this approach, share innovative solutions, and develop necessary training and tools. Ladies and gentlemen, to meet the expectations of our citizens and secure a prosperous future for our youth, we must act with urgency and, above all, with ambition. As we address health challenges, we must protect the most vulnerable and ensure no one is left behind. I often say, when I say those words, that I sound like Miss Universe. But no, honestly, I really do believe in that. And I hope that more people will do believe that this is really very important, that no one should be left behind. So by empowering and institutionalizing social participation and inclusive policy making, we can build more trust on our health systems and align services with the needs of diverse communities. Evidence shows that this approach delivers better outcomes, improves compliance, and drives innovation at every level. Today's event brings together countries, UN agencies, civil society, and youth to advocate for action and policy solutions, placing health, equity, and well-being at the heart of decision-making. We stand united by the principles of participation, solidarity, and multilateralism, building momentum together in anticipation of this week's UN events the second summit for social development in Qatar, in prosperity, and in healthy societies, there is less chance that the conflicts are going to occur. And that's why I think that this is so strongly interconnected, that we have to give as much attention as possible to health and to the work of the World Health Organization. So, thank you.
Thank you, President Musa, for that really powerful opening and introduction. And not to labour a point, but I think you've really touched on the heart of this. This is about health democracy. This is about ensuring that everybody has a role to play in society, and we create societies where people want to participate and can participate. And that leads to better health, better economies, better cohesion. So thank you for that. I'd like to now move on to our second distinguished guest and to introduce His Excellency Dr. William Samoei Ruto, the President of Kenya. Welcome. Great to have you with us today. We've got a very distinguished career. Previously, more than a decade as Deputy President of the Republic of Kenya, working in a number of portfolios in the government cabinet, and over a decade as a Member of Parliament. Your Excellency, can I ask you to share with us why social participation to drive equity and sustainable development is a priority for Kenya, and tell us about the journey so far?
Thank you very much. Your Excellencies, distinguished participants, ladies and gentlemen, on behalf of the government and people of Kenya, I want to affirm one basic fact, that health, as we say in Kenya, is not a privilege for those who can afford. It is a right for every citizen. Rights, however, matter not when they are proclaimed on paper or in theory, but when they are realized in practice. This is why Kenya places people, communities, and their voices in the very heart of health governance. Distinguished delegates, social participation is the bridge that connects policy to people. It ensures that communities not only benefit from health services, but also help shape the decisions that govern them. It is in this spirit that Kenya strongly supports the World Health Assembly resolution on social participation and social connection in 2025, which we view as vital instruments of transformational governance and inclusive development. When communities participate in health decisions, three things happen. First, policy becomes responsive to real needs rather than remote directives. Second, accountability and transparency flourish as citizens can follow and track how resources are used. And three, health systems grow stronger and more resilient, trusted by the very people they serve, especially the most vulnerable. In Kenya, this is how we ensure that expectant mothers has access to essential antenatal care, that every child receives life-saving vaccines, and that families are supported in confronting the rising burden of non-communicable diseases. Ladies and gentlemen, Kenya's commitment to social participation is firmly anchored in both law and policy. Our Constitution guarantees the right to the highest attainable standard of health on one hand, and the right of citizens to participate in governance. Both are constitutional imperatives. The Public Finance Management Act embeds citizen input in budget making, including in health, while in the Health Act outlines mechanisms for community engagement in service delivery. We are also aligning policy with action. We recently enacted 4 transformative laws to drive universal health coverage reforms. And why I say we had to change the whole architecture around law to be able to make health much more responsive. The old law had no place for people. The old law did not give voice to the vulnerable and to the people at the margins. And that is why we had to change the legal framework completely. Yet legislation alone is not sufficient. Participation must be practical and tangible. To this end, Kenya is pursuing 5 concrete strategies. First, we have empowered community health promoters with medicines, smartphones, and stipends, co-financed by both levels of government to ensure that last-mile delivery of essential services is done. We have 109,000 community health promoters around Kenya, and we facilitate them to visit every home. And this is to bring the insights and ideas of local communities into the health delivery equation. Number 2, participatory budgeting has been strengthened at both levels of government, supported by digital platforms to help communities track health resources transparently. Thirdly, Kenya is reinforcing primary health care networks so that communities can actively shape planning, implementation, and oversight. Today, every facility, every hospital facility in Kenya participates directly using what we are calling financial inclusion fund to make sure that they can decide the resources that are being used in every health facility and on what areas. Number 4, health literacy programs are being expanded to equip citizens with knowledge to make informed decisions and engage in meaningful governance. And finally, we are promoting multi-sectoral collaboration by linking health with education, agriculture, and social protection, thereby addressing the broader social determinants of health. Together, these strategies are strengthening trust, deepening accountability, and building a health system that truly serves ordinary people. Yet, despite this evident progress, challenges remain, chief among them sustainable funding or financing. The recent withdrawal of some external funds not only revealed diverse vulnerabilities, but also underscored a profound lesson. Ownership matters. When communities set priorities, monitor spending, and contribute through local mobilization and volunteerism, resilience is strengthened. I say this that today we have enhanced local mobilization of resources for health. There was a time we depended on USAID and all the other good people. But today, our 300 billion shillings health budget is wholly 100% mobilized using domestic resources by Kenyans. It speaks to sustainability and predictability. Social participation is therefore not only a moral obligation, but also a financial strategy that reduces waste, increases efficiency, maximizes impact, and builds ownership. In Kenya, we are deliberately building a system that is less dependent on external aid and more firmly grounded in domestic solutions and community leadership. Ladies and gentlemen, as we look at 2025 World Summit on Social Development, Kenya affirms that health equity is inseparable from social justice and sustainable development. We call on this meeting to embed social participation indicators in global health frameworks and share knowledge and innovation that empowers communities to shape their health destinies. Another critical indicator that should be embedded in social participation is the commitment of resources not only to medicines and infrastructure, but also to the democratic right of people to participate in decisions that affect their health. Together, we must forge a renewed global social contract anchored in solidarity, participation, and equity, where every person, regardless of geography or status, has the right and the power to shape their health, their future, and their societies. Thank you very much. And I don't feel like Mr. Walt.
Thank you, Your Excellency, for putting very clearly on the table that social participation and equity are not just goals in themselves, but they bring wider benefits for trust, for cohesion, for ownership, and for being able to steer through difficult times when these come from externally as internally. And they're very, very important. So thank you very much for that. I would like now to turn to our final, but not least panelist on this session, which is Katrin Jakobitterstorff, who is currently the chair of the Pan-European Commission on Climate and Health for WHO, and formerly, as I know you, was the Prime Minister of Iceland and a champion for the WHO European Wellbeing Economy. Katrin, I know through your political career, transformation through participation, genuine dialogue has been at the heart of your portfolios as Minister of Education, Science and Culture, Minister for Gender Equality, and latterly as the Prime Minister. Can you tell us how, in your current role as Chair of the Commission, ensuring equity is at the centre of the work, and how is the Commission amidst the seeming backtracking of climate change, tackling this by engaging diverse voices? Katrin, over to you.
Well, thank you so much, and thank you, Natasha, for hosting us, and thank you, Natasha and William, for your very inspirational remarks, because it is important that we talk about health equity and social participation, not least in these very turbulent times. And I think Natasha said this very clearly when she described, the world we are living in right now. I entered the Icelandic parliament in 2007, 2008, we had an economic crisis.
You're not that old.
I am so old. I'm not competing in this Miss Universe competition. So when I entered parliament, there was an economic crisis just after that. 3 of our banks collapsed. It was quite a big bankruptcy. Then I became the Minister of Education, Culture and Research, having to do the budget cuts in very difficult times, really relying on genuine dialogue to kind of create that atmosphere that we cannot go through a crisis without social participation. And I think that actually, I learned a lot of lessons back then, and when the pandemic hit us in 2020, I could actually go to that toolbox, because I don't think, Iceland did very well through the pandemic when we look at number of deaths and how everything proceeded. And I think we relied on social participation then, but of course we also had the strengths of a public health system with equitable access, which is really the key to all this. But I might add that we also had a very strong collaboration between the public and the private sector. And, I mentioned the economic crisis in 2008, the pandemic, but I could also mention what Natasha already said, the conflicts that haven't been more since the end of Second World War, the human displacements, the effects of climate change that we're seeing everywhere around us, and the new technologies, which, I sincerely believed when we saw the changes happening because of the new technologies, that we were seeing more democracy, more dialogue. But what we are seeing is that people are becoming more and more isolated in their own bubbles, and more power is going to the tech giants. So therefore, I would just like to say here at the beginning that multilateral collaboration has maybe never been more important, but also dialogue to try to understand each other in these very precarious times. Now, you asked about the Commission. Yeah, I was in professional politics in Iceland for many, many years, and a prime minister from 2017 to 24. So let's say that health equity was always one of my core issues, not least through the well-being economy. But when Dr. Hans Kluge so kindly asked me after I had left professional politics to chair an independent pan-European commission on climate and health, I immediately said yes. I did not have to think about it, because I truly believe that we can make a difference, and I truly believe that these issues have never been more important, because what has happened because of these times of permacrisis, we see that climate has gone down the agenda, and also the fact that people maybe that are not all of them realizing that the climate crisis is also a health crisis. And I think what we are seeing is that, and the data shows us, that we really need to scale up climate action to achieve benefits not only for climate but also for health. And the evidence also shows us that all areas of our health are affected by climate change. So you mentioned mental health. Mental health is affected by the climate crisis, but also if we look at more kind of known factors like the emergence of vector-borne diseases like dengue and Lyme disease in new regions, respiratory and cardiovascular conditions due to air pollution. We are also seeing the climate change is undermining our food systems, causing malnutrition, food insecurity. It threatens access to clean water and poses particular risk to pregnancy and maternal health. And then, of course, we have the extreme weather events such as heat waves, wildfires, floods, becoming more frequent, more intense, creating humanitarian emergencies and having that effect on mental health that a lot of our people are experiencing through anxiety and because of climate change. So what I firmly believe is that we need to address these challenges systematically. If we do not do that, we will leave our communities vulnerable and our health systems overstretched in a very unpredictable world. So the mission of the Commission is very clear: to accelerate decisive climate action that also protects and promotes health. And what we have been discovering in our work, we've already had 2 hearings, we have the 3rd hearing now in the beginning of October, that so many things that we can do that actually have a positive effect on climate, but also a positive effect on health. So often what's good for your health is also good for climate. And we are really, what we've been doing is creating the solid scientific ground to stand on. We have been assembling best practices and successful cases where we actually see that change is happening. And by spring 2026, we aim to deliver actionable, practical, and measurable recommendations for policymakers across the region. And we have talked a lot about this. We don't want to make a very, big report that we know that some will read, but definitely not many. We want to have it a very short and concise report and focus on the recommendations to create a toolkit for leaders around the region on national level, on local level, because often leaders on local level can make a huge difference. Strengthen health policy, leadership, investment, action for climate mitigation, resilience, health protection, and societal resilience. And resilience is so badly needed these days. Now, the Commission is made up by 11 commissioners, chief scientific advisors, and because you mentioned dialogue, so we are consulting as widely as possible in a very limited amount of time with scientists and experts, public health agencies, civil society, youth policymakers, etc. And we are trying to assess the interconnected global and regional risks that climate change poses to health, consequences of inaction, cost of inactions and the opportunities to enhance health through robust mitigation and adaptation. Now, the European region is the fastest warming region in the world. And I come from the subarctic, and what we're seeing happening in the Arctic, it's that climate change is happening even faster there. And what we say, the cost of inaction will be more than the cost of action. We all bear responsibilities towards our citizens when it comes to protecting their health, and therefore we really need to look at this connection between climate and health, but also because we know it's overwhelming. We know that policymakers say, hey, I'm here for 4 years. What do you expect me to do? Solve the climate crisis? No, but we hope that we will be able to provide those policymakers with recommendations that are actually implementable and doable, and that can give us positive results in a certain amount of time. So I won't take any longer. I know I'm over my time already. But this is a very important issue, very close to my heart, but not least because I think right now we really need some positive messages that this is possible. So thank you all, and looking forward to hear from others here.
Thanks, Katrin, also for reminding us that what we constitute evidence needs to come from a whole range of diverse voices, because only when we have those different perspectives, including the lived experience and also from different communities, do we really have the basis for proper engagement and decision-making. So thank you for reminding us of that. What I'd like to do is, our panelists are not jettisoning off yet, I hope, but are going to be part of the debate and will be coming back later on to give their reflections on action and priorities for moving forward. So I'd like to thank our initial high-level speakers. And now I'd actually like to turn to Dr. Hans-Henry Kluge to share with us why, Hans, is WHO putting so much emphasis on the issue of equity and sustainability and engagement of diverse communities of practice. Hans, over to you.
Hans, just before I give you the floor, President Ruto has a meeting with Secretary General. This is the reason why he's leaving. It's a 10-minute slot, and it's a railway station at the Secretary General's office. I have a slot at 4:30, I think. So so that's the reason why he left. Sorry, Hans.
Dear Madam President, former Prime Minister, delegates, civil society leaders, when people themselves